All right, Dr. Travers, come on in. All right, you can have a seat in the chair right here. Yeah, so we have one of your patients who has shared their experience of the care you've given them, and they wanted to say thank you.
My name is Ron Thomas. My physician's name is Dr. Chad Travers. I've known Dr. Travers since actually a daughter of mine, my oldest daughter, babysit for him. So we've had an ongoing relation for many years. I think he trusts my knowledge as I trust him. I had another doctor that I started with, and I don't like to say I lost some faith in him because he recommended a procedure that I didn't agree with. This was a big deal to me. When I found out that Dr. Travers was going to another facility, I actually moved mentally and physically over to his place, that being Bryan in Lincoln. He would listen to what I had to say. He didn't go along with everything, of course, because he knows the deal. I, of course, don't. But I had researched it and found out as much as I could on the internet. He explained what every move he was going to make and what it would hurt or I would not feel it. It ended up my asking him, he said, okay, you can set up now. I couldn't believe the procedure was over. It was that good, that quick and fast. It was unbelievable to me. Just took a few minutes. From day one, Dr. Travers asked me the right questions and treated me with respect as not just an elder, but as a person he has known for a long time, to get to the right end, to get where we need to get. After the procedure, I went back to Dr. Travers. I rehearsed in my mind how to maybe thank him. I didn't really do it well. There are no words to describe that. And I told him that, and that's all you can do, is say, I don't have the words to say how thankful I am. I can't do it. He said, I understand. And I believe he does wholeheartedly.
I've probably known Ron for, I would say, the last 7 years, probably. And that's in a clinical situation. As Ron said, we've known each other for a long time, and you see these folks that you've known for a long time, and people you can help out, and that's what keeps you going on a daily basis. So I think as cardiologists or as doctors, we know what we should do, and we know what the research shows, or how you're supposed to treat a certain condition. But I think the most important thing is when you meet with the patient and you're sitting across from that person, you have to figure out what's best for them. I do think of myself as someone that does listen to the patient and does like to hear what they're saying, because I do know everyone's different, and especially in Ron's case, I think we have a mutual understanding of each other. But to come together and to get that outcome that we got, that's quite special, and I hope to continue to do that and pride myself in hearing what the patient has to say. The thing that I always come back to is why I went into medicine, and that is to certainly help people. But it's also something that selfishly I get something out of too, and I get to come to work. I get to do what I like to do on a daily basis, and I think if each physician can find what they like to do, I think that their job will be quite rewarding as they move forward in their career.